Thank you for welcoming me to lovely Cyprus. I wish I could have been there live, but this will have to do. I want to
Hopefully
talk
next time.
about, hopefully, I want to talk about something that I don't hear so much during this crisis, which is the opportunity we have to finally, once and for all, fix healthcare. Because healthcare is not really efficient. I know we have a lot of technologies and a lot of medications, but for us patients, and I'm talking on behalf of a lot of patients out there, we don't feel we're getting the right treatment that we want to get. So I want to have a short description of what I envision as an opportunity to fix healthcare. So I want to start by talking about remote health. Remote health is a subject that's being addressed widely right now because of the need that we have. We cannot physically go see our doctors in most cases, and we must actually talk to the doctors online. We had these technologies for more than 10 years right now, but they were poorly utilized. When I'm talking about poorly utilized, most of the health organization around the world didn't have a proper service to actually allow daily operations of remote visits. And now, what happened in Corona is that they've been struck with this urgent need. And when this urgent need came, they had to find crazy solutions, very fast solution. The innovation adaptation was very fast, and it's not something that health organizations are usually used to. And because of that, what we see is actually a situation in which the FDA in the States is allowing companies or health organizations to actually use any type of video call service without what we call HIPAA 5 certifications, without the proper privacy measures, because we could not have enough time to actually adopt these technologies. And I think that this is a very good example of how can we try to see remote health as a daily kind of operation method that we can save a lot of time, a lot of money for healthcare. Using technology and those online visits, we can actually see less physically our doctors, but more efficiently, because many of the doctor visits are actually just for getting a prescription or getting some sick note. And if we're talking about that, we don't really need to take 10 minutes or 15 minutes of the doctor's time and drive to the clinic. So this is a very good example. For us patients, especially for people who are disabled and it's very hard for them to get to the clinic, I think that remote health should be the standards. We shouldn't drive so much and be in a hassle to see our doctors, but we should get better care. We should get more visits, but less maybe physical. So this is the first thing I wanted to address. And I wanted to give a very cool example. There is a company in Israel called Healthy.io, and it's the first company in the world probably who got an FDA approval for using a remote service for urine testing at home. So basically, you can purchase online or purchase physically in a pharmacy or get it from your doctor this small kit in which you can put a sample of your urine, and then you scan this specific outcome to your phone. There is a little paper that comes out, you scan it to your phone, and it's actually FDA approved urine sample. So you don't have to go to a special lab and you don't have to make all this hassle. So this is one really cool example of remote health starting to be the standard. And we are in the future going to see more and more blood testing being done on site, urine testing on site, and other testing being done on site, and of course medication being delivered to us. So we're talking about starting to put health more at home and less in the clinic or in the hospital. But this is only one example, and I wanted to discuss if we're talking about home care, the entire surrounding, because I believe, as a patient and as an innovator, I believe that this is the place to innovate, because when we're talking about admissions to a hospital, most of the admissions are, of course, costly and actually not very efficient, because in many of the admission, unless it's intensive care like we see with corona patients or post-operation care, we actually see patients that are seeing the doctor for like 5 minutes a day. They have their vitals being taken a few times a day, but actually they're just laying down in a hospital. Most of them don't even have to be observed. So in my hospital of the future, most of this admission, unless it's a major trauma or intensive care or a 24 hours post-operation or procedures, we're going to see most of the admission being done at home. We have cool technologies already in place with FDA approval. We have a really cool company called BioBit in Israel that provide a watch, much like this Apple Watch, the same size, something like that. And this watch is FDA approved to take all the vitals that the nurse in the hospital can take, like your temperature, your blood oxygen, your pulse, your ECG, and so on. So this is a medical grade smartwatch, and they have a version which is a bit bigger for hospitals. And actually, in the corona wards in Sheba Medical Center in Israel, in Tel Aviv, they're using BioBits to monitor the not very acute patients with corona, the ones that are need to be in a hospital, but not need to be completely monitored like the ones that we see in intensive care. So imagine that every patient will get this kind of watch going home and be in his own bed with his own comfort and his own family, but being monitored using those remote health tools like video calls, monitoring, and services that can come to home. A nurse, if it's urgent, can come to your home. So I'm not sure we need these facilities that we're using today. If we're talking about the BioBit wearables, in my view, whenever I'm asked about what is the greatest opportunity to give patients the power to actually be connected to their caregivers, I'm talking about wearables. And what we're seeing today is just the tip of the iceberg. We're seeing those companies launching more and more features every year, oxygen monitoring and some form of ECG, but we haven't seen nothing yet. We have patents coming in and already been registered. And we have examples like this BioBit of smartwatches and other wearables that completely can monitor almost every aspect needed for medical care and admission. And in my view, we're going to see more and more patients being connected via digital health tools to their main physician, to their health organization like HMO, and us patients are going to actually be more busy in getting better, being engaged in preventive health, in mindfulness, in healthy nutrition and exercise, and less in being busy in maintaining these follow-ups for chronic illness. Because if we can predict earlier illnesses and promote health, and using those wearables to be an intermediary tool to prevent, promote, but also alert for something wrong that is happening, and if it's happening, to be monitored with, we're going to see an entire new future. And again, as patients, we don't want to be in a hospital bed waiting for somebody to kind of maybe give us attention. This is not something we want. We want to be like everybody else. So I think wearables are the answer. We're talking about wearables that are completely out there in the market right now, but we are going to probably see, in the meantime, two different wearables, the ones that are FDA approved and are more medical, and the ones that are more leisure, like the Fitbit and the Apple Watch. And slowly, we're going to have, in my opinion, an Apple Watch that is going to be more like the BioBit that I was talking about, and more like medically grade. And you see it already in the operating systems, you see it in the patents coming, and I think it's a great opportunity to actually help make healthcare better. R&D and research, we see a lot of fast things happening. What's happening? Like the procedure should be the same procedure regarding safety of drugs and medical products and medical equipment, but because of this world catastrophe, more processes getting rapider. So I'm not talking about sacrificing safety in any way. I'm just talking about adapting innovation in a way that will allow us to move forward. And in times of crisis, we see that everybody comes together and all these innovations coming out. Some companies that were maybe on stealth mode, now they're showing their product, want to help. There are so many solutions born in Corona times, and we're seeing slowly CE organization, FDA organization, other organization in the world, like in China, that are kind to start to adopt faster and faster those certifications. And this will be our future. Our future will be much faster, but still maintaining the same kind of safety level. It's super important. And the great example for it was during World War II, in which innovation were adopted very, very fast. Sometimes during a few months, you can see a new type of, I'm afraid it was more weapons and stuff like this, but also in medical sciences, you had a lot of advancements coming. And one of the best examples is the way that the United States actually trained doctors, because they didn't have time for wait for this long period of pre-medical studies, 4 years, and other studies of medicine, 4 years. So actually doctors have been trained in 4 years altogether, and it's shown to actually be good, and those doctors were good doctors. So even training can be adapted better into this crisis to better train the staff to deal with situations like this and to make everything faster. Maybe even we're kind of wasting time in our training processes for medical certificates. This is another topic. And for me, the most important thing is basically bringing back patients into the center, because I as a patient had to experience years and years and years of lying in bed without any diagnosis. And basically, I didn't know if I'm going to live or die. I didn't know if I'm going to walk or not walk, because I had a traumatic event in my military service and my body began to deteriorate. And after a month, I couldn't function anymore. And after a while, I couldn't walk anymore. And in the beginning, because I was very young, doctors tried to tend to me and everything was very professional and efficient. But over the time, without diagnosis, patients are being labeled as the lovely statement we always hear, it's all bad. So we see a lot of patients in this situation that are falling between the cracks in healthcare. And healthcare is completely not designed to treat patients. Healthcare is designed to basically, like a conveyor belt, to intake a patient. He has some problems. We need to fix those problems as much as we can in a medical legalic way, and then spit it out on the other side, usually without proper follow-up in terms of the emotional and physical needs of the patients. Usually you get some prescription and they tell you to see another doctor in the community. In my story, it was so bad, eventually after seeing 32 doctors, I didn't have any diagnosis. And what happened is that I had to go to the senior professor, the most senior professor in my hospital group. And after he didn't find anything wrong with me, he basically told me and my parents that I will never walk again, never go to university again, never marry a woman again in my life. And not again, but never marry in my life. And as a patient, I felt that the system is basically giving up on me. So what I had to do in this situation, because I tried every possible way to communicate with my doctors and private doctors and other hospitals and other clinics, and nothing helped. So I had to actually learn medicine for 2 years, study from my bed, and diagnose myself. And this is the last thing we should do as patients. So when I'm talking about centering the patient in the system, is building a system that it's actually human oriented and not sick oriented, because the feeling for us patients is that doctors are more like firefighters and they fighting symptoms, they putting out symptoms after symptoms. But as a patient, you feel lonely, you feel mistreated, you feel you're falling between the cracks medically and bureaucratically, and you really don't know how to navigate this thing called health. So now it's the opportunity we have to actually build a system around the patient and not around the illness or the medical staff. I'm seeing things happening around the world. We see patients doing policy. I was honored to serve as the first, probably in the world, patient in residence or chief patient for the Ludwig Boltzmann Institute, is the largest health research institution in Austria. So I urge every organization that deals with patients to actually appoint a professional patient to be the patient in residence, to present the needs and represent the patients and come up with policy making and adaptation of innovation that is patient-led innovation and not only doctor-led innovation, because eventually benefiting from innovation should be the patients. I'm calling to every organization around the world dealing with patients to put patients in their boards. And the first decision I've put in every board regarding these hospitals that I worked with, 2 patients in the board of directors, and you see amazing changes coming out of it. And this motto that I wrote here, nothing about me without me, saying that we're not doing stuff to involve patients in healthcare. They call it patient involvement. This is not involvement. This is our world. You are in my world now. So everything should be around me, not about me. So this is how I see this coronavirus as an opportunity to do all this. And the last thing I want to discuss is eventually who is going to be my doctor. And I think it's about time to kind of set things straight in about a few months from now, when the corona will hit again. Hopefully not. We're going to see the same problems healthcare had, and the same problems is usually around lack of staffing, lack of training, lack of resources. I believe that we're going to see more physician assistants, more nurse practitioners, those highly skilled, highly trained professionals taking care of the patients, especially in admissions, in hospital care, and more technicians doing scrap work, because I don't see why a doctor should draw blood from 30 patients in a ward or connect the ECG and run between those things. The doctor can do a lot, still touching the patients, still talking with the patients, but we need to allocate and we need to delegate other things that we can. So I see doctors more as pilots, the system running on its own, and the doctors are supervising, they're making the decisions, they're in touch with the patient, they're making the decision about the patients. But in the future, I believe that doctors are going to be more of supervisors, and they'll be assisted by decision support system, AI, big data is going to come more in place. And it's finally time to it's the time to put more decision support systems in place. I don't think that any human doctor, unless he's a savant, has the capacity to actually know by heart 32,000 registered illnesses. So yes, we need to use more decision support system. If my case would have been dealt with a decision support system, I would have waited a month and not 7 years to be diagnosed. I spent almost 7 years until diagnosis, and altogether almost 9 years in bed. I lost almost a decade of my life. With these systems, we're not going to see it anymore. And for the patients, we need more companion apps. It's time to put patients in the center, also in the fact that in between the visits, patient needs something to hold on to. So this is something that is super important. And I want to end with this note. I'm quoting myself, but it's really important for me to say it. I always keep saying it every talk that I have. It's healthcare is the only industry in which customer opinion doesn't matter at all. And imagine a dream company or a snack company or a car company that just build cars and they don't care about the opinion of the clients. It's not going to work. Thank you so much, and I would love to take a question. Thank you.
We're going to start with Lauren Curry, who says, sounds like useful health tech, but are you concerned about the privacy or the security issues associated with these type of wearables that collect sensitive medical information?
Yes, I'm very concerned, and luckily for us, we live in the European Union, and we have somebody taking care of our privacy. And this is a privilege, because in the US, this is not the case. It's more breached. And I believe that we are going to see more and more policy and lawmaking regarding of the use of medical data. And eventually companies like Apple, even selling Apple Watches, will have to answer about what they're collecting. Usually Apple is not the problem. There are much worse companies than this. But yes, we're going to see more systems, more integrations into the EMRs or EHRs, the electronic medical records, for those wearables. And when it's going to be like that, you're going to have to use HIPAA 5 or equivalent. So yes, it has to be in line.
Yes, okay. So we're going next to Piotr Gregory. Interesting insights. Thank you for sharing. What is the single biggest problem in healthcare globally that you think needs urgent fixing? Is it access, financing, lack of doctors, or something else?
I think that the corona epidemic is just a child play compared to what we're seeing. The greatest epidemic coming is the chronic illness epidemic, and we're seeing more and more and more young people sick with chronic illness. And when we look at the financial numbers, the economy is not really working with this, because we have more and more young disabled people living on countries' benefits. And we are about to see a huge collapse of healthcare, social healthcare, even here in Europe, if we're not going to change and pivot the way we're treating illness, in which we have to allocate at least 50% of the entire budget to prevention and health education and promotion. If not, we're not going to sustain, even in Europe, social healthcare.
Absolutely. Thank you for that. So thanks for joining us again.
Thank you so much for having me.
Bye.